This is a disaster story for a patient I just saw a few weeks ago in my clinic, and it brought me to think about some things. This is a gentleman that came to me that reportedly had about 1,700 FUE grafts performed in Dallas, and he had only probably about 6 or 7 of those grafts out of 1,700 growing. His donor area was not fully compromised yet, thank God. But on the front side, he just had a few grafts growing out of the 1,700, which was shocking to me. My survival rate is way over 90%, and possibly way higher than that in most normal FUE cases. But his graft survival was close to 0. And what's interesting is that the grafts that did survive were also miniaturized. And it's not due to the fact that the person's donor hair looked compromised. In other words, if poor hairs were chosen to be transplanted, that would be one story. But in this case, they were high-quality grafts, most likely, given what I looked at in the donor area. But they were miniaturized. And the reason why they were miniaturized is due to traumatic insertion, traumatic harvesting. So all those combinations caused the issue. But what this podcast actually is talking about, which is shocking beyond all of that, is the person actually had a transgender type of hairline or female hairline, and this person was not transgendered. It was a female hairline that was made on the scalp, and it was a very odd appearance. Now, fortunately, it was such a bad FUE transplant where so few grafts survived that I told him that he actually didn't even need to remove those hairs because you could barely see them, but they were shaped in a female hairline pattern. So like 6 hairs grew in some weird distribution along the scalp. But again, you could only see it when you're really close up to the scalp. And I asked him what was going on, and turns out the doctor allowed him to draw the hairline. And so when he asked me whether he could draw the hairline, I said absolutely no. He was trying to show me what he wanted. And this is the issue, is that even when I teach my students at my workshop in St. Louis on how to do hairline design, the new guys that are just starting out, they listen to all the basic principles of how to make natural hairlines. You can listen to those lectures on YouTube. They still have no real concept of how to do it well because it takes years of experience to draw a natural hairline to see when a hairline looks artificial. And so this gentleman that had this hairline drawn, that the hair surgeon gave the pen over to draw it, I will never do that. And the other thing is people say, should I bring in some old photos? No, because the old photos of your old hairline really don't matter to me. What I need to see is where you are now. And I need to think about in the future, how can this hairline not only look natural now, but how is it going to age for you in 10 years, 5 years, 15 years, 20 years? What are the things, what supply do I have to manage future problems? A lot of doctors, especially nowadays that salespeople are meeting with you, not doctors, there's just a complete callous disregard for what you look like in 5 to 10 years because they can pocket the money and leave. So the biggest thing I want you to understand is my standard of natural is so far beyond yours, and I'm not going to give you the pen to draw your hairline in because it's not going to look right. Now, of course, if there's something you don't like about what I've drawn, if there's things we can talk about, I can discuss with you, we can make modifications, but those modifications always have to fall in the realm of natural. I will never just give you a pen and let you go for a free-for-all. There's actually one exception to that. The one exception to that is eyebrows. Because eyebrows, they all come in all different shapes and sizes. And for me to just draw the eyebrow before, in the past I would draw the eyebrow and people wouldn't have, not be happy with it. They wanted a different way. So now I let them start with drawing the eyebrows the way they want them, because people pluck and shape eyebrows in different ways. So once they get that design down, then I will then modify it. For example, I had a gentleman that was from Houston that wanted a monobrow, a unibrow, and I just thought that was not in good taste. And I was able to actually spend a long time negotiating with him to get an eyebrow that still looked natural and dissuade him from that, because, that's probably one of those, of course a unibrow is natural, it's just not attractive. And so the eyebrows, though, is probably the one exception of where you would probably be given the pen to start the drawing process. But for hairlines, absolutely no, you should not start the process of drawing it. And this is what sort of bothers me, is today we're in a world where doctors are not really in charge of the procedure. Salespeople are in charge of selling it to you, and then you get away with results that just look abysmal.